president's trade deal with the EU puts a 15% tariff on imported medicines from Europe. How do you stop the drug makers from passing along those costs to people on Medicare and Medicaid?
Guys, I'm off the grid for August, but something actually super interesting happened, and I can't wait to hear about it when I get back in September.
I want to start on drug costs. The president put this 25% tariff on India, big drug producer. The president's trade deal with the EU puts a 15% tariff on imported medicines from Europe. How do you stop the drug makers from passing along those costs to people on Medicare and Medicaid?
Well, the president's letter on Thursday for most favored nation pricing is a good example of that. And he's been working on this tirelessly since the first administration. And just to put this in context for many of the viewers, about 2/3 of bankruptcies in America are caused by healthcare expenses. About a third of people, when they go to the pharmacy, they leave empty-handed. They can't afford the medication. So the president has said, enough global freeloading. We've been covering much of the development costs for new drugs to cure cancer, deal with lots of other illnesses that are life-threatening. It isn't time for the American public to understand that we should not be paying 3 times more for the exact same medication in the same box, made in the same factory. So the president's saying, equalize it out. Let's use a model that's worked, for example, for external threats. That's what NATO did. Everyone has to pay a little more. We'll pay extra too, but we won't pay a lot more than everybody else. So they actually have to raise their contributions, in this case to an internal threat, which is illness. We'll pay a little less in America. That way more Americans can afford these medications, and it's a fair system for the entire globe.
Is that intended to offset what will be, cuts to Medicaid? And do you know, if the companies are actually going to follow through on this? Like, how do you actually strong-arm them into doing it?
Well, just get the numbers correct. We're putting $200 billion more into Medicaid. So we're actually investing in Medicaid.
Costs are going up.
Costs are going up, but there's been a 50% increase in the cost of Medicaid over the last 5 years. So I'm trying to save this beautiful program, this noble effort to help folks, giving them a hand up. And as you probably gather, if Medicaid isn't able to take care of the people for whom it was designed, the young children, the dawn of their life, those at the twilight of their life, the seniors, and those who are disabled, living in the shadows, as Hubert Humphrey said, then we're not satisfying the fundamental obligation of a moral government. And this president has said over and over that he believes that it is the wise thing and the noble thing to help those who are vulnerable. And every great society does that. We're going to as well.